Assalamu alaikum dear students, welcome to your channel The Anatomy Canvas, and in today's class I am going to explain the model of the muscle in the head and neck area. So I will start first with the muscle. So here you can see that this is the area of the lip and the nose and the eye. So muscle which is surrounding the area of the lip, the first muscle, which is the orbicularis oris muscle. Then the muscle which elevate the area of the lip is the levator lipi superioris. It has the two slits. Then at the angle of the mouth you can see another muscle is present, which is the depressor anguli oris muscle, and here you can see another muscle which is the depressor labii inferioris muscle. This one is the depressor labii inferioris, levator labii superioris muscle, depressor anguli oris muscle, and here you can see the mentalis muscle which is present. This is present in the area of the chin. Then the other muscles which are present over here, you can see this one, the main muscle. This is the zygomaticus major muscle and the zygomaticus minor muscle. Then you can see another muscle of the superficial facial expression, that is the rhizorius muscle, which is present over here. And behind the rhizorius you can see this one is the buccinator, and here you can see the masseter muscle which is present. Moving on to muscles of the eye, then you can see that this is the orbicularis oculi muscle, and this orbicularis oculi muscle has two parts. This one is the pectoral part of the orbicularis oculi, and this one is the ocular part of the orbicularis oculi muscle. Then here you can see another muscle which is present. This is the frontalis muscle which is present over here, and here you can see a small muscle which is present in this area. So this is the procerus muscle which is present. Corrugator supercilii is present basically behind the ocular part of the orbicularis oculi muscle, which is not visible in this model. Then you can see another muscle which is temporalis muscle present over here. This is the posterior auricular muscle, and here you can see the occipital belly of the occipitofrontalis muscle. So these are the muscle. Again I repeat, the orbicularis oculi muscle, the levator labii superioris muscle. Here you can see the nasalis muscle, the zygomaticus minor muscle, zygomaticus major muscle, rhizorius. Behind this is the buccinator. This is the depressor anguli oris. This is the depressor labii inferioris. This one is the mentalis. Here you can see the masseter, the orbicularis oculi muscle. Here you can see the procerus muscle, and here you can see the frontalis. In this area you can see temporalis, posterior auricular muscle, and the occipitalis muscle which is present over here. Moving on to the area of the neck, you can identify very clearly this large muscle. This one is the sternocleidomastoid, and behind this is the trapezius. So first, moving on to the muscles in the anterior compartment of the neck, you can see that we divide these muscles into suprahyoid and infrahyoid muscle. So this white area is the hyoid present in this area. This one is the anterior belly of the digastric muscle, which is one of the suprahyoid muscle. Then the muscle behind this belly is present, and here is the posterior belly of the digastric muscle, and then you can see behind this is the stylohyoid muscle which is present. Infrahyoid muscle which are present over here, you can see from the thyroid cartilage to the hyoid, this is the thyrohyoid muscle. Then this one is the sternohyoid muscle, and this one is the superior belly of the omohyoid muscle. And posteriorly you can see over here, this one is the splenius capitis muscle which is present. Then the levator scapulae which is present over here, and then the scalenus medius anterior and posterior muscles which are present, the three scaleni muscle which are present over here. So these are the muscles in the suprahyoid muscle, the infrahyoid muscle, and muscles in the posterior part of behind the sternocleidomastoid. Moving on to the other structures which are present in this model over here. So you can see first of all that this one is the external jugular vein which is present in this area. Then you can say this artery which is present over here, this is the facial artery, and this facial artery is giving two branches, the inferior and the superior labial artery, and then it becomes the angular artery over here. In this area you can see the superficial temporal artery which is present, and this superficial temporal artery gives a branch. This is the frontal branch of the superficial temporal artery, and this one is the parietal branch. Both the artery and the veins are present side by side. Here you can see the zygomatico orbital artery which is present over here, and behind in this area, occipital area, you can see the occipital artery and vein which are present. So occipital artery and vein, the superficial temporal artery and vein, the frontal branch of the superficial temporal artery and its accompanying vein, the parietal branch of the superficial temporal artery and its accompanying vein, then the zygomatico orbital artery and its accompanying vein. Here you can see the facial artery and its accompanying vein, the superficial superior and inferior labial branches of the facial artery, the angular artery which is present in this area and its accompanying vein over here. So these are the different blood vessel. Here you can see the parotid gland which is present in this area, and the duct of the parotid gland, you can see this is present above, anterior to the masseter muscle. So this is all about this model, and thank you very much for your attention, and Allah Hafiz till the next class.